Hello, my name is Fernanda Cunha. I am a singer from Brazil, graduated in psychology, and I came to Canada last year to study recreation therapy, and I am completely in love with this profession. And from now on, every week, I will be here inviting one guest to speak and share with you. So today is my first interview, and I could not think of anyone other than Krista Banks. Krista is a recreation therapy professor at Lambton College in Sarnia, Ontario, a great professional, very passionate about what she does, and she has an ability that I consider one of the most important features to work with people. That's empathy. She's very empathetic. So let's see if Krista is here.
I almost ran away.
Oh. Hi, Krista. Welcome.
Hi.
Thank you so much for coming, for being here with us.
Oh, you're most welcome. It's a first for me. So
Oh, yeah. It's first for me, too.
Yeah.
We are in the same boat.
Yeah, that's right. So we'll swim this together.
Yeah. So let's start talking about a little bit about yourself, your background, and the settings you have worked.
Sure. I just want to do one quick second. Can you hear me okay? We didn't kind of do a background. So can you hear me, or should I put my microphones on?
Yes, I'm good.
You're good? Okay.
Yeah.
Okay. Just want to make sure everyone can hear me. I'll throw these over. Okay. So yeah, I've had a very great career so far, and started out right out of high school, going away to school, and wasn't really sure that recreation therapy was for me, but my mom thought it was, and little did I know how right she was. And initially challenged because I didn't see a lot of my coworkers, a lot of my classmates were very interested in more the athletic side of things or more sports, and I wasn't that girl. So yeah, it just kind of went, and I found my way and found my path. So it's been fun.
Good.
Yeah.
I know you have answered this question many, many times, but I still see people who have no idea what recreation therapy is. So,
Yeah.
in your own words, what's the proposal of recreation therapy?
Wow. That is always, as you are so right. It's a challenge I think we challenge our students to do that. And even in your profession, you're asked sort of that elevator pitch of what you're going to say. And I mean, you can pull out Therapeutic Recreation Ontario's definition, Canadian Therapeutic Recreation Association's definition, and they're great. And I encourage you, if you're wanting to find out more, to do that. But for me, I have throughout the years you change it with the people that you work with, the different populations, and depending on where someone's coming from. So for me, I would say it's a coming together with people. You're going to meet and work with some people who are going to rediscover or find a new recreation and leisure opportunity. And you're like, there's assessment parts of that, but just you're meeting with that person. You're going to find out about that person and go from there and find and hopefully create as much independence as possible. That's always the goal.
Mm-hmm.
Mm-hmm.
And Krista, how do you evaluate if an activity you just implemented worked well? Because of course you can feel if patients are enjoying or not, but I mean, are there any other tools to evaluate, like feedback from doctor, nurse, family, or something?
Evaluation, yeah, part of that therapeutic recreation process. And my students are probably anyone who's listening in are going, oh, how's she going to answer this? Yeah, evaluation is a trick. I shouldn't say a trick. I should just say it's sometimes hard to assess the benefits and how it has helped someone. You obviously, there is an evaluation process. If the people you're working with are able to respond and react, then you're going to ask them, because they're first and foremost who you're serving and who you're working with. So you would ask them. If that's not possible, often you would talk to families, just because you've already done an assessment process. So the families, you kind of know what's going on in the family's life and their past history. So then I would also check in with, if you're not able to do that, you would check in with the staff that you're working with, the other staff, to see if there's any changes, or if you're noting if there's agitation, because that's obviously a negative response. So there's usually a formula, right? There's a nice series of questions, and you want to really think about that when you're deciding who's going to answer that evaluation. And I know we shared yesterday a little bit when we were talking, you were talking about blood pressure, which was an interesting one for the music therapist. And I thought I was new for me, but it was really interesting, because there's so many different possibilities to see. And obviously they're wanting to see a decrease in anxiety and stress, in which we're all sort of goal oriented towards. So evaluation is, you're hoping at the end of your program. I mean, sometimes it's a 3-month process. Sometimes you just check in with the group at the end of their program. You just sort of say, so do you want to do more of this? What went right? What went wrong? How can we change it? Usually your participants are your best gauge.
Sometimes just ask, how are you feeling today before and after, right?
Yes.
How are you feeling now?
Yeah, that's great. Yeah.
Simple things, but the blood pressure is funny, but I think it works. I heard this from a music therapist. She used to do that when she does a one-to-one session. She usually takes the blood pressure before the session and after the session. I thought it was interesting.
Yeah, it would be interesting to see her results from that. I like that.
Yeah. And do you prefer to work one-to-one or in groups?
Well, if this was a job interview, you better say that you like.
I would love to. I would love to.
But seeing as it's not a job interview, I would have to say, initially, I prefer one-to-one, mostly because I don't know the person. And once I got to know the person, especially if you're responsible for an area, or you're responsible for a group of people you're just trying to get to know, it's nice to kind of, even after your assessment process, it's nice to just get to know them a little bit more and find out. And then you really find out what larger group things they like to do. So it's more of an easy transition. Large groups are fun. And I would say one-to-one, then there's the small groups, right? And then there's the larger groups. Yeah. So, it just is figuring out, depending on what I would probably choose one-to-one in small groups, but the larger groups are fun because you get so many people and there's just lots of energy, right? There's lots of fun and times to get together and get people together that you wouldn't necessarily pair up with. So, yeah. But that's not my job interview question.
No, it's not your job interview question. Just, I had an experience with a sweet lady around her 90s, and she lives in a long-term care facility, and she likes to stay in the room all the time.
Yeah.
Or alone in a small table outside the room, just coloring books. And I have asked her several times to come to participate in activities with no success at all. One day I told her there was a lady living there who uses to play piano, but she feels like she's not good enough. And I told her that would be awesome if some friends could go to see her playing. It would help to increase her self-esteem. And so I asked her, would you do it for her? And she accepted. So she made it for the other lady, and because she's generous and empathetic. But at the end, she was also benefited by the attitude, right? From the attitude. So what strategies do you consider when you face situations like this, when the patient doesn't want to participate in the activity?
Yeah, that was a great example, Fernanda. Really great example. So for me, it's always about getting to know the person, getting to know what makes them tick, and if you can't get that information from them, sharing it, finding out from the family, sort of. And what a great approach that you had with that. I would, I would say that's my first technique, is just to get to know them, find out what they used to like to do. And obviously there's some sort of event that's happened that's changed that. Maybe they always were in their house by themselves doing whatever, or working outside. Like they spent a lot of time alone, and maybe they just don't like larger groups. But that approach of helping somebody else is great. I also like to just also do a little bit of negotiation, like just saying, well, let's just go check it out. You don't have to stay. Just come and let's go together. Often the together will help, so they don't feel like you're just going to wheel them into a room and leave them all by themselves, because they've learned that, right? If they've lived in any sort of institutional living, that they could be abandoned in that environment and not able to maneuver themselves necessarily. And just it's really about getting to know that person and just trying. I definitely would prefer the person's wishes, but we also know that for their own mental health, they also do need to be around people and surrounded by people. So just finding the best way to do that. And some large groups aren't for everybody.
Yes.
Yeah.
Yeah.
Yeah. Some people thrive in that environment.
Yes. And what was your most successful outcome as a RT when you realized you did the right choice, the right profession? Could you give us some example?
Okay. Well, the biggest one for me, actually, it came back to me, and this is something that I think in any profession, you don't always get feedback on how you've done, and that can be trying after a while, right? If you don't get feedback of it, whether you're doing a good job or not. And so I had worked with someone in hospital and who'd had a stroke, and throughout my assessment process, when I first went to meet them, you could tell that they were distraught and not handling this change very well. And it was a beautiful day, so I asked the staff if they could get him set up and we could go outside. I thought maybe taking him outdoors, just checking that out, and he agreed to that. So we went outside, and I ended up walking him around the block, and we just sort of talked. And that was sort of the beginning of my assessment process, just to find out what made him tick. What did he like to do? What he had done in the past? What he saw going forward. And so we did that. I think I took him out, I'm not sure how many times in total, but the assessment part was about twice. I took him outside and learned a lot about him, learned he was a bit of a joker. And so I ended up in a similar situation to you. I had this few people that I knew could hear well, and got them all together and asked him if he would tell some jokes. So That went over pretty well. It was just, I think, 3 other people aside from my joker. And but I would continue to take him outside, and sometimes we'd take a couple people outside just to get outside. And so then fast forward, he was discharged. I lost touch, right? You do when somebody is discharged like that. And so years later, I get a message from a friend who says to me, I don't normally post things. And I think she posted it in some small group we were part of. And she said, I don't normally post these sort of things, but she says, I was sitting across the table from someone, and he started describing the recreation therapist that he worked with in the hospital, and starts to tell this story about how I had saved his life. And I found that, I mean, that's pretty strong words, but I was very touched by that, right? That he had felt that significantly I had helped, even though I did these small things, right?
Yeah.
I didn't have a ton of time to dedicate to him, but I met with him where he was at, tried to find out. I mean, it's a pretty significant life-changing event when you have a stroke and you've lost function, and how are you going to go forward? So it was really neat to actually A, know that he was doing well, and B, that I helped in some way. So that was sort of a neat opportunity, just because it came back to me, which you don't always. And we've had different, when I was in the hospital, we had different patients would return just to kind of give us, they were in day program, and they would come and just kind of check in and say how they were doing. And so that was nice. But you don't always get that. So that was pretty neat.
Beautiful.
Yeah.
Yeah. I'm so sorry we don't have this in Brazil yet. We don't have recreation therapy there.
Yeah. That's unfortunate. So when you're in...
Go ahead.
Go ahead. No, you said, I think.
Yeah, I think it's just Canada, United States, Spain, and Japan. Is that correct?
You'd have to look that up. You probably know more than I do internationally. Yeah. Sure. That's what Google's for, right?
Because it's so important. Yeah, because I searched before I came. I was searching for that. We have occupational therapists, art therapists, music therapists, but we don't have recreation therapists. And so it's so important. It's so different.
Yeah, it is. It is really important, and it's like a lot of professions. We're still pretty new, so not everybody knows what it means. And I, by no means, am an expert, and so my definitions, I mean, they're open for improvement always, but it's definitely a profession that is growing, and it grows at different times, at different political needs, and but it's definitely very worthwhile and beneficial. I had. Do you have time? Do we have time for another story?
Yeah, sure.
Okay. I had another lady. This was more of a long-term care story. She came to my area with quite significant dementia, and so she was already in a wheelchair, not able to communicate very well, and but there was just something about her that in meeting with the family, like when we first when someone first comes to live there, you meet with the families and discuss and find out a little bit about them. So I knew I was going to have to find out a lot about this woman. And so I learned that she used to like to write. And so, of course, initially I'm like, okay, so she's not, in my physical assessment of her, it wasn't looking like I was going to be able to get her to write of anything of significance, maybe not even her name. But I thought I was doing a small little writing group. I thought, okay, I'll put together this little small group and let's try and see. So I brought her to that group, gave her pencil and paper. Obviously, when she was with us, I didn't leave her with that because we weren't sure of her functional abilities. And so she started to write. And I wouldn't say it was something that would be legible to us and that we're going to be reading later, but she wrote. And that was a neat moment for me to just say, okay, I have this group that I'm getting together primarily because of her, let's just write we would write letters, or we would write short story things. Like, we just do anything people wanted to do. And one day when this was happening, her husband, I think it was even the first day, her husband came to visit. And instantly he was in tears. Because she was in a group with other people, which sometimes if it's hard to describe her, but I think if you've met anyone institutionally that has quite significant dementia, you'd kind of grasp what I'm talking about. And that she had a pencil in her hand, and he says, I don't know the last time she held any sort of writing utensil. And so that touched me, right? I was like, wow, okay. And so I said that, I can set up a little bin and we can have a paper and pen in her drawer when you come to visit, if you want to see and try. And I don't know if he ever did. We didn't really talk about that, but she continued to come to my group, and I told him she would. And so it's just those small things, right? That you're not necessarily just touching. I don't know if it meant anything to that person, to that resident. I don't know, but I know how much it meant to her husband to see her in that normal behavior or normal action for her. Mm-hmm. Yeah, it was pretty neat.
What kind of interventions do you think is more effective in dementia? Music, and music is pretty.
The whole music, right? Yeah, like the music and memories. I sort of had a bit of time when I wasn't working full time in recreation therapy. I'd left the environment for a bit, and then I came back, and music and memories had exploded, and I was so excited. That's just, obviously people have video of all kinds of experiences, but music is so instrumental. But key, as you would well know, it's music that appeals to them, and finding out that music and knowing. Mm-hmm. Like, I don't know what music would be chosen for me. When I'm at that stage, hopefully I'm not, but if I get to that stage, because it is so key, right? Mm-hmm. Yeah.
I met one patient with the same long-term care, and she's Portuguese. She's from Portugal. And she stays all the time in the room and doing nothing.
Yeah.
And the manager said, well, she doesn't like to talk to anyone, but if you want to go ahead. And then I speak Portuguese, and I don't know if she speaks Portuguese. Because she lives here about 50 years, but when dementia comes, sometimes they don't know how to speak the language.
That's right.
Language. But anyway, and I went there and I introduced myself, and she was like, and then I asked her, do you like music? And no. Okay. Oh, I love music. And then I got my iPad, and I showed her Amália Rodrigues, which is a big famous singer in Portugal. And when she started to listen, she said, Amália. So it was, I almost cry because you know me, right?
Yes.
Yeah, but so music is powerful.
And her experience would be asked to go to music, and it wouldn't be music that spoke to her. It would be our bands that come here locally, right? So of course she's going to say no, even if she did. Yeah. That's awesome.
Because everything you ask her, she'll say no.
Yeah. But how wonderful. And that's, that's the key for me is finding that key, right? You just have to find the key that lights those people up, or lights all of us up, because it's including me. And especially we're finding that when we've been so isolated this last little while. It's, you just have to find what works for you. And something else I was just thinking about when you were talking about that story is I did for a short time a sensory baking program, and the regular baking ladies weren't very happy with me because they weren't invited this time. But we did a group where I think there were about 6, maybe 8 in a room, just a small, we had like a kitchen area. And I had brought bread dough, and I had put it all around for each person. Each person had their own makings for a bun, and varying levels of functional ability. Some it would only be the aroma of the dough, but I had this group of ladies in the room, and it was pretty significant for me, because then we're just the whole process of just kneading the dough. We did a bit of mixing, but I already had pre-made dough already, because I knew time-wise that we weren't going to be able to get everything done. But then I also wanted to bake it so that they could smell the experience. And again, that's one of those programs that I loved to do. But you don't get that reward of somebody saying, "Oh, that's so delicious," because we didn't eat the bread afterwards, because I wasn't washing their hands before we did it. We were just it was more experiential and sensory. And I let them just do whatever they wanted to do with that dough. And it was pretty cool. And then they went off to lunch. It was just before lunch program. So I think I had a small loaf that we just had a taste for those who could eat it, because that's another thing to consider, right? But it was just a different idea. Just trying, and that's, so what you need to do is try. Yeah, sure. Like anything. Yeah, it's like trying anything. Like us right here. Yeah. our first live experience. Yes. So it's So and it won't be perfect, and it will be what it is, and it will be fun. And that's what you have to do in recreation therapy, is that adaptability and seeing the needs that you have, and looking at the people that you're working with, and seeing what would work for them, versus just going, okay, well, I like to do this. I like my one-to-one and small group programs. But it's what do they like? What do they want? What do they prefer to go on outings, or what's the majority of my functional abilities and their loved ones? Mm-hmm.
And you are also a teacher. Krista was my teacher.
Yeah, I was so lucky. Oh, that's a new adventure for me, and definitely a learning curve, steep, and hopefully going well. It's been fun, but and a lot of transferable skills. Often when in interviews, they'll want to talk to you about transferable skills. Well, this is definitely, if you had asked me 5 years ago if I would be teaching recreation therapy, I would have said definitely not. But this opportunity came, and here I am. I'm giving it a shot, and I'm enjoying it immensely. It's wonderful to see the life and excitement in the students, and I'm thankful to the college for believing that I have something to offer.
Yeah, you are fantastic and inspiring. Everybody loves you.
Well, thank you. I appreciate that. I appreciate that very much. It's I'm doing my best, and I'm learning all the time. And it's kind of funny preparing for this today. We were talking about nervousness, right? And I often have students we have to do presentations, because part of working in recreation therapy is getting in front of people. And that was also part of the reason why I never thought I could be a recreation therapist, because I didn't want to public speak. But you learn and you get over your nerves, you get over your everything, all those physical symptoms that you get. They still come, as you and I spoke about. I mean, they will always be there, but they are helpful. They're there for a reason. And so I used to say that to my students. It's okay. We're going to work through this. Let's get this presentation. No, you can't get out of doing the presentation because it's beneficial. It's beneficial, and you're going to need to do it in the real world when you get there. Yeah.
Krista, what do you? It's a competitive profession, do you think?
Competitive? Is that?
Yeah.
Competitive. Well,
there's enough jobs for everybody, or
I couldn't give you the statistics on that. I wish I had looked something up like that. No, I realize that would be helpful for me. I know there's definitely a need for more recreation therapists. I think it's becoming more recognized as we go along in different areas. I've been excited to hear about some of my students getting jobs in areas that I'm like, I wouldn't know back, 20 years ago that would even be possible. We're definitely not a governed body that only graduates enough people to fulfill the profession. But I think that it's just finding your way in that. I know long-term care, there's been a great need. I know that's been emphasized in the college system. But I do know that there is a definite need for money. Yeah. But it's not easy. I have some students right now who have made the decision to go back to school to further get more education, because they feel that it'll increase their opportunities. I'm a huge advocate for getting out and working in some way so that you kind of get some experience behind you in lots of different ways. I mean, but you're competing in some age demographics with different graduates. So it's just getting that knowledge out there that recreation therapy is, that we're very valuable and helpful.
And what do you suggest to your students to become an exceptional professional?
This is like a test.
It's like a test. No, I just want to learn.
Oh, I'm kidding. Okay. Oh, so many things. I know, Really, what the first one I can think of is you need to have, I think you use this word more than I do, which I love, is passion, right? When you talk about music and about passion, and I love that word. You need to be passionate about being with people and about sharing what you already have. Because I think at the beginning of every year, I always comment about, like, you're coming to the table, even as fresh students, first year students, you're coming with already experiences and life skills and things that you can contribute to the people that you're working with. And so to remember that, I think another one is listening. I think we're in such a fast-paced world. We have so many distractions. It's hard to focus even on yourself sometimes. But just to listen to the people that you're working with and to remember that they're the reason why you're working, and that you're there to help them and to fulfill their goals. Yeah. I wrote down some cheat sheet notes thing, and I had something else in there I wanted to say. Just being open to that your experiences are going to continue too, right? You're going to continue to learn. If somebody wants to their life goal is to go skydiving, you might be going skydiving, right? Like you might be setting that up and learning about that. And I know that's an extreme, but there's all kinds of experiences like that, that to not to dismiss that person's goal because you don't know anything about it, but just encourage to be open to find out what they want. That's what it's ultimately about.
There's Alex says, "Hi, ladies. This is so cool." Monica is a psychoanalyst from Brazil. She's amazing. She's great. Monica, you want to send us some questions? Please do it. Krista, sometimes we feel overwhelmed. And yeah, and you are empathetic person, so
Thanks.
yeah, you are always, it's good, but yeah, for you sometimes it's hard because it's like a sponge, right?
I do.
Yeah, and sometimes we feel overwhelmed. How do you do to reduce stress in your life, self-care? I know you are a runner. I know you like sports. What else?
Okay, yeah, good question. Okay, so the answer is keep trying lots of things. You find what works eventually, and it changes. It's always changing, just like everything in life. It's changing. So yes, I did allude at the beginning that I was not an athlete in any way. Growing up, I was more the musician, ballet person, so sports was really not my world. And then, yeah, I was introduced. I always thought running would be fun. Yeah. And actually a coworker at the hospital said she was doing a learn to run class, and I said, "Oh, I can't run." Talk about limiting beliefs, right? Like, oh, I can't run. I'm a recreation therapist, but I can't run. And she says, "Well, silly, that's why you take a class. It's called Learn to Run. And you're always learning from other people, right?" So I'm like, oh, okay, good point. So I went out and I tried to run, and I couldn't get around the block. I think I got like probably 10 meters and I was like done. And so then I decided to learn to run. So that has been a great social outlet for me. I've met a lot of wonderful people who I would never, ever meet under any other circumstance. It's just been really fun. I've got healthier, and it is a good stress reliever. Although since January, I signed up for a marathon, and that was my bucket list because I was going to retire. I kept saying I was going to retire from running, and my friends would laugh, and I'd say, "Yep, I'm retiring from running," but so I was ready to quit. And then I remembered that I had a goal to run a marathon, and I hadn't done that yet. So some friends agreed that we should do a marathon in the spring. And of course, the world turned upside down, and that didn't happen. So when that was looking like it wasn't going to happen, I quit running. I said I had enough of that. So I decided to walk. So my stress reliever lately, since that time, has been walking with my girls in the morning, and sometimes Rob, my partner. And I also do a bunch of other things because although walking helps, sometimes I need to do some yoga, which I was introduced to by, again, a friend. Introduced me to yoga online. So that was pretty cool because I wasn't sure about going to a gym all the time and doing yoga.
Yeah.
So that's been fun. There's no pressure, right? I can do the best I can. And I have done yoga in studio before, but sometimes you just don't get there. I also have done and was introduced in the hospital. This psychiatrist there was a real advocate of meditation. And so he would talk to the patients. And so then they in turn would come in and talk to me about it. So I sort of learned it vicariously and talked to him a little bit, and followed some of those techniques online as well. And wow, that was really cool. Really neat to learn, and really eye-opening for me that there were other options, and that psychiatrists weren't just about giving you medication. So that was really neat. So that's helped. I also have, this is my little ball. I was planning to take this to class. This is my little squishy ball. So I was squishing this before that, just to kind of exercise my muscles and de-stress my mind. There's a whole list, because once you learn a lot about the therapy of the process of therapeutic recreation, you just get exposed to so many things, right? Because you need to kind of, I shouldn't say you want to learn more things that can help the people that you're working with. And in turn, you recognize that you're having struggles too. And another thing that I got into this last 6 months is dealing more with plants again. I'd kind of gotten away from plants. I had always done like a horticulture group wherever I worked, and but I sort of lost interest and wasn't doing it that much, and so now I'm into that again. So that's helping me show up here
and to relax,
and saying, yes, Fernanda, let's do it.
Let's do it. So Sheila is saying, yes, you can run. Olivia, with several half marathons to prove it. Olivia said.
You're right. Yes, I have. Yeah, okay. Yes. Lots of races, lots of fun half marathons. And last year I did, was it a half? No. It's in Newfoundland. It was the Telly 10 miles. So I did that last summer, and that was supposed to be, it was great fun. And it was fun. Yeah. Hi, Sheila.
There's a psychiatrist, Monica, and she's saying recreation therapy sometimes is a way to keep not alive, but to live after some kind of mental disturbs. Do you agree?
Absolutely. Yeah. I usually, and I didn't say that in my little comment about my own words about recreation therapy, but usually when you're talking to somebody who doesn't know anything about recreation therapy, I usually say, picture yourself having a life-changing event where you have things that you can't do anymore. The things like golfing, the things like cutting the lawn, the things that you love to do. Maybe it's working with carpentry. Maybe it doesn't matter what it is. Maybe it's baking. Maybe it's horticulture. You've had that life-changing event. So you can't do that anymore. And it's finding a way to still do it, or finding something new that still makes you feel alive. So that's really neat. I like that.
Yes, there's something I didn't ask you, or something you would like to say? Lots. There's lots.
Breathe. Breathe.
Don't do it.
Oh, man. I admire people who do this all the time, or do this as a profession. I mean, I mentioned to you yesterday, you get up on stage and sing and perform, and
but it's always hard. It's always hard. You're always nervous too. Yeah. It's part of the game, right?
It is. It is. Yeah. So let me look at my cheat sheet for a second, because I wrote down some little things I wanted to make sure I covered. Just sort of ideas, things that I could help. Yeah. Oh, I have two more stories I can tell you quickly. Are we getting tight for time?
Yeah, we still have 10 minutes. Yeah.
Okay. I'll tell you the one story then. So I had, okay, I'll start. So I had a gentleman that, as I said before, had a life-changing event and was, I am in no position to say that he was depressed, but by all descriptions around him, he wasn't enjoying himself, wasn't enjoying his new life.
Mm-hmm.
And so we found out that we needed to do some cleaning in the courtyard, and that there was a deck area that was dirty and needing to be cleaned up because it had been neglected. So I asked if I could bring in, we had a pressure washer at home. I asked if I could bring in the pressure washer and I could work with some men to pressure wash this deck, realizing it wasn't going to happen in one session, right? One group of time. It was going to take, it would be a bit of process, but just to kind of find something for men that would be helpful. So I got approval to do that and brought this pressure washer in, and the men loved it. The men absolutely loved it. But one particular gentleman just wanted to do it all the time. Just wanted to do it all the time. He just loved it so much. And this was the gentleman I was most worried about in our group, because he just seemed to always be sad. And so he just would come and ask me all the time to do that. So you have to be kind of diplomatic, right? In trying to say, well, okay, we've got this designated time that we're doing this. I can't just, and he couldn't understand because of his circumstances, that he couldn't understand that he couldn't just take the equipment out there and do it himself and get it done, right? Because he was probably somebody who didn't walk away from a task that was half done. So you just have to kind of look at all of those different things. So that was a learning curve for me to just kind of go, okay, so I need to be very clear, and maybe we needed to accomplish a smaller task. So it wasn't, I think it took us, 3 or 4 sessions to try and get all of that done. So he was just wanting it done quicker. But just, you learn so many skills, right? And diplomacy and communication and negotiation with people.
Yeah.
So, yeah. And my other story comes from when I worked, that was when I learned how valuable, and we've actually been talking about it when we've been walking, the girls and I, the importance, and this is more specifically for men, again, the importance of the coffee shop, like the Tim Hortons and the McDonald's. And when I met with this one gentleman, that's all he wanted to do was, he wanted to go meet his guys at the Tim Hortons. And so that was really important to him. And I didn't realize how important social was, that social connection there for them was, because every morning he went there. So that was sort of our process was, okay, we were working on the speech language, people were working on speech language, and physiotherapy was working with physiotherapy. And it's like, okay, well, this is all towards this goal. So it kind of brought it all together for him. It was like, okay, you need to work on communication so that you can talk to your guys again. And then you also need to be able to walk there. He could walk, but he was having some difficulty. So we worked on strengthening. And so it was really off all of our teams coming together and collaborating, which was really cool. And so, but I got to have the joy of taking him to his first coffee shop group. And that was just, it's just eye-opening. It was just, that's all I can say. It's just eye-opening of how you can touch somebody in such a small thing. I think, oh yeah, but it was all he wanted to do. That was just get together with his guys again. So it was, yeah, I've got so many things like that. Like just how it's touched me, right? It's how those sort of things, it doesn't just, it's not you're focusing on them and trying to find those things that work for them and get them being independent again. But it falls back on you too. You get the benefits too.
Sure. Yeah.
Yeah.
There's another question, but I think Talk a
It's
little
too
bit
hard.
about us. No, hello. How did you decide to be a recreational therapist? What made you follow this path?
Ah, okay. Well, I think I alluded a little bit at the beginning about my
Yeah,
mom sort of
yeah.
choosing my profession,
She
but I can
probably
tell
did.
you I know more now about why she did that because I grew up in a little neighborhood that there weren't any other kids. There was one child up the street. She was much younger than I was. So I used to disappear and go and visit some of the retired people in the neighborhood. I would kind of go around and socialize. So I know my mom sort of thought from that perspective that I liked to be with other people. I wanted to socialize. But for me, when I sort of the light bulb went off for me of like, okay, yeah, I can find my way in here in this profession, and a lot of it has to do with confidence, right? Just
Yeah.
finding that confidence. Um, but there's such a vast. I started out working in group homes, so you just find the group that works best for you. The population. I often ask in class, and I think a lot of people do ask in their classrooms, sort of. So, what population do you think you'd like to work with? And that can change. Like I've started out working with people who have disabilities of all different kinds, and
Mm-hmm.
then I moved to long-term care. I did some time in retirement home, yeah, and then into hospital where you worked with children of all ages up, yeah, to all kinds of people. So yeah, it's just hard. Each person has their own story, right? As to what helped you find your way. And like I said, I didn't think this was the profession for me for a while, and but when I've been teaching now, it's like, oh my gosh, how could I have not have seen that? How could I have not seen how much fun I was having, how I enjoyed that, and I think I've told and said in class so many times how many opportunities just presented themselves for me, and I made a choice to take those opportunities, and I have zero regrets of each one. I loved each element of them, and I mean, don't get me wrong, nobody's in any job with every piece of it that they love every day. But there is when you look at it, has to weigh, the positives have to outweigh the negatives, and they did in each job choice that I made, and I'm grateful for that. And,
Mm-hmm.
yeah, and I'm hoping that I can convey that to my students and in this big world
Yeah, you
of live Facebook and your new exciting YouTube channel, Recreation Therapies Corner. I'm so excited.
are.
That's really cool.
So, Krista, thank you so much for coming, for
Yay!
your time. Thank you.
Hey, you're most welcome. It was great fun. Yeah, and I wish you all the best in all this venture, and I'm sure to tune in. And thank you to everybody who
Yeah, thank you everyone for
today.
staying with us.
Yeah,
And
yeah.
next week we will have another special guest, Mary Hawkwood Lang. She is from the United States. She's an artist, speaker, activist, professor of nursing at University of Florida. So I'm sure we will have a lot to learn from her too.
Yeah, I look forward to it. Thanks, Fernanda.
Thank you,
Thanks, everybody.
Krista. Bye, everybody. Thank you so much.